Good morning, everyone. I'm Sun Hui from Department of Rheumatology, the first hospital of China Medical University. Today we will talking about systemic lupus erythematosus. In briefly, we can call it SLE or lupus. And today we will talking about the laboratory test and the diagnosis and disease activity for lupus. First, let's look at the laboratory test. The purpose for the laboratory test is to establish or rule out the diagnosis for lupus, and also to follow the course of the disease. The laboratory test can suggest whether the flare is occurring or to evaluate whether the organ damage is developing. And also by the laboratory test can identify the adverse effect of the drug therapy. The significant laboratory test for the lupus patients are the autoantibodies. There are many autoantibodies in the serum of lupus patients. The most important one, we can see that nearly 98% of lupus patients may got anti-nuclear antibody positives. So the anti-nuclear antibody, ANA, is the typical antibody for lupus patients. The antigen for ANA is the multiple nuclear and is the best screening test for lupus patients. That means that if the patient is ANA negative, we must pay attention to, be carefully to diagnose this patient with lupus. The second one is anti-dsDNA antibodies. Nearly 70% of lupus patients may have anti-dsDNA antibody positive. The antigen for this kind of antibody is DNA, especially the double-stranded DNA. And the head titers for anti-dsDNA are lupus-specific antibodies. In some lupus patients, the titers for anti-dsDNA antibody correlate with the disease activity, correlate with nephritis, and also correlate with the vasculitis. And the titers of anti-dsDNA antibody may decrease after the appropriate therapy for such kind of patients. Next one is anti-Smith antibody. Nearly 1/4 of lupus patients may Smith antibody positive. The antigen is the protein complexes to nuclear RNA. Anti-Smith antibody is also the specific for lupus, just like the anti-dsDNA antibody. But there's still some difference between these two kinds of antibodies. Anti-Smith antibody is not correlated with the disease activity. And the anti-Smith antibody usually may occur with the anti-RNP antibody at the same time. And nearly 40% of lupus patients may got anti-RNP antibody positive. This antibody is a targeted antigen for the protein complex to the RNA. It's not as specific for lupus, but the high titers for anti-RNP is associated with the mixed connective tissue disease, MCTD. Anti-Ro antibody, we can also call it SSA, is occurred in 30% of lupus patients. The antigen for this antibody is the protein complex to RNA, usually is 60 kD or 52 kD. It's also not specific for lupus, but it's associated with the Seeger syndromes, and it's associated with neonatal lupus, and also it's associated with a decreased risk for the nephritis. Anti-La, we also call SSB antibody, may occur in 10% of lupus patients. The antigen is 47 kD protein complex to RNA. Also, it can be occur with the SSA antibody at the same time. It's also associated with the Seeger syndromes and also with the decreased risk for nephritis. Antihistone antibodies, about 70% of lupus patients may have antihistone antibodies. Its antigen is the histone associated with DNA, and it's specific, usually specific in the drug-induced lupus, such as penicillin, such as anti-TNF-alpha drug, drug-used lupus. Antiphospholipid, nearly half of the lupus patients may have antiphospholipid antibodies. The antigen is the phospholipids in the cells. If the patients got antiphospholipid positive, it's quite easier to clotting, to get fatal loss, and to get thrombocytopenia in the clinic. Anti-erythrocyte antibody, nearly 60% of lupus patients can be anti-erythrocyte antibody positive. This antibody may attack the erythrocyte membrane and develop the hemolysis. Antiplatelet antibodies, it may attack the surface or the cytoplasmic antigens on the platelets and can induce the decreased number of platelets in the clinic. It's associated with the thrombocytopenia. Anti-neuronal antibodies, nearly 60% of lupus patients may got anti-neuronal antibody positive. The antigen for this antibody is the neuronal and the lymphocyte surface antigen. It's correlated with the active central nervous system lupus. And anti-ribosomal P antibody is the antigen is protein in the ribosomes. Also, it's correlated with the central nervous system lupus, such as depression or psychosis due to the central nervous system lupus. Except the significant autoantibodies test, there are still some other standard tests for the lupus patients. The first one is the blood test. The complete blood test, we can see the decreased number of the blood tests, including the decreased number of white blood cells, the decreased number of platelet count, also the decreased level of hemoglobin. And also we can do the urine analysis. We can see the hematurorin and the proteinurin in the clinic. And still there are some other immunologic indexes, such as the complement. We can see the decreased number of complement, including complement 3, complement 4, complement H50. And we can see the increased number of immunoglobulin and gamma globin by the laboratory test. Kidney biopsy is quite useful in the clinic because it can be used to the diagnosis, to the treatment, and to the prognosis of lupus patients. Because we know that for the different class of the biopsy, we need to choose different drugs for therapy. Such as for the class 3, class 4, we need to choose the high dosage of corticosteroids and the cytotoxic drugs. And for the end stage, for the class 6 stage of lupus nephritis, probably the drug therapy is not useful. Probably patients may need the renal transplantation or may need dialysis. The diagnosis of lupus, the diagnosis of lupus is based on the characteristic clinical features and the laboratory test, especially the autoantibodies. At this moment, there are 3 criteria for lupus. The earliest one is the 1997 criteria for lupus of ACR. In this criteria, including the 11 items including the clinical manifestations, the laboratory test, and also including the immunologic indexes. If the patients get 4 or more items positive, we can diagnose it with the lupus. The second one is the 2012 criteria for lupus. In this criteria, it divided into 2 parts. One part is the clinical criteria. The second part is the immunologic criteria. And in the clinical criteria, there are 11 items. In the immunologic criteria, there are 6 items. If the patients get 4 or more than 4 items positive, we can diagnose it with the lupus. But there's some important points we need to show us that if the patients get NA positive or dsDNA positive, and by the kidney biopsy, we can see the lupus nephritis. Only these two items, if the patient is positive, we can diagnose it with lupus. And the second one, I just told that if the patient's 4 or more symptoms are okay for the diagnosis, in these 4 symptoms, must at least including 1 clinic and 1 immunocriteria. The third criteria for lupus is the 2019 criteria for lupus. It's a quite new one. So at the clinic, we seldom use this criteria for lupus diagnosis. We usually use the 1997 and 2012 criteria for lupus patients. For this criteria, is a diagnosis according to the score. This criteria divided the patient's clinical manifestations and the laboratory test. And for each items, they got the different score. And if the patients, the total score of the patients is higher or equal than 10, we can diagnose it with lupus. But there are still some 2 points we must pay attention to. First, the patient must be ANA positive. That is, the titer for ANA must be higher or equal to 1 to 80. And the total score is higher than 10, must including at least 1 clinical criteria. That's the diagnosis for lupus. We will see the disease activity for the lupus. After diagnosis for the patients, we need to treat the patients with different drugs. We will treat the patients according to the disease activity and select different drugs. The disease activity for lupus, we usually use the SLIDA, SLAM, or OUT. But SLIDA is quite common in the clinic. It means the systemic lupus erythematosus disease activity index. We can see the SLIDA can be divided into 4 groups. In each group, we will get different scores, such as 8 points, 4 points, 2 points, and 1 point. For the highest score, for the 8 points, usually is associated with the NPSLE, the central nervous system syndromes of the lupus. And for the 4 scores, usually is associated with the lupus nephritis, such as the hemorrhoid, proteroid, the cast. And for the 2 points, usually associated with the immunoindex differences, such as the antibodies, abnormal antibodies, the low complement. And for the score 1, is usually associated with the blood change, such as the leukopenia and the thrombopenia. If the patients get more than 4 points, it means that it's an activity stage of the disease. So that's all for today's lessons. Thank you very much.